everyone, good evening. Welcome to Health on Debate Facebook Live. I'm Janice and I'm the host for today. Today we have Dr. Komala with us, an internal medicine consultant from KMI Kelana Jaya Medical Center. Hi Dr. Komala.
Hi Janice. Hi everyone. My name is Dr. Komala. I'm the internal medicine specialist from Kelana Jaya Medical Center. So my special interest will be endocrine, basically diabetes management, rheumatology, in which we actually treat about joint and joint diseases, and hematology, which is blood and blood disorders, and kidney, basically. That's what I'm trained in previously. Yeah.
Okay, we know that November is the World Diabetes Month. So this is established by the International Diabetes Federation. Yeah. And in conjunction with it, we have Dr. Komala with us today to share about what you need to know about diabetes. Okay, according to the National Health Morbidity Survey in 2019, 1 in every 5 Malaysians adults have type 2 diabetes, which is around 3.9 million of people. And this shows how common diabetes is in Malaysia. Doctor, can you share some info on what is diabetes and how they affect our body?
All right. Thank you, Janice. It's a very good question. So diabetic is actually a chronic condition that affects the glucose processing and blood sugar regulation. Okay. All right. Typically, we eat, and then the sugar that goes into our body is digested, and the food is actually converted to glucose, right? So from there, insulin takes over and aids the absorption of glucose into our cells and various organs in our body. But unfortunately, this does not happen in diabetes mellitus patient. Okay, this process is impaired, so in which there will be increased glucose in the bloodstream, and that's where all the complications such as heart, blood vessels, eyes, and nerves, and other complications happen, Janice, So basically, what we have to remember, insulin is produced by pancreas, and it regulates the blood glucose level, and something is wrong in pancreas and insulin resistant, causing it.
So when there is something wrong with your blood sugar, then in the long run, it will become diabetes.
Exactly.
Okay.
Exactly. Regulations. Yep.
Okay. So as well, we know there are a few types of diabetes, like we have type 1 diabetes, type 2 diabetes, gestational diabetes.
Yes.
Yeah, and the type 2 one is the most common type, is it?
Yeah.
Yeah. Can you share with us, like, what are the difference between these types of diabetes?
All right. Okay, Jenny. So type 1 is basically what most commonly we see in childhood, and they are diagnosed very early stage. Okay, it is because it's an autoimmune condition in which the insulin producing cells in the pancreas is actually destroyed by antibodies produced in the own body. All right, so typically they present very early stage, and they come very ill, okay, with complications that we see children admitted in ICU, right? So type 2 is more common. It comes a bit more gradually, right? And there are a few risk factors associated with type 2 diabetes as well, okay? And while type 1 is characterized by insulin deficiency, there's no insulin at all. Type 2 is more of resistance and dysregulation in the insulin and also glucose in the body, all right? And there's a third type, which is called gestational diabetes mellitus. It happens in pregnant ladies, okay? Because the hormonal imbalance during pregnancy, the sugar regulation becomes altered, and thus causing gestational diabetes. All right.
Okay. Doctor, what are the common risks of this diabetes, and how actually people can assess their risk?
All right. So risk factor for diabetes mellitus can be assessed by various factors, okay? What are the very important risk factor in diabetes patients? The family history. Okay, although we hear when you have family or any relative with type 2 diabetes, you say you'll get diabetes, but it's not a rule. Okay, although there is risk factor, it's not a rule that you have to get diabetes if your family has diabetes. All right. So next will be obesity. Okay, when your BMI is less increased, okay, according to your height and weight calculation, right? So there's lack of physical activity, sedentary lifestyle, desk jobs, all right? Unhealthy diet, okay, diet which is not restricted. Age, the more elder you are, the more prone you are going to get diabetes, gestational, like I mentioned to you, and then other hormonal conditions. We call it Cushing, okay? There is actually a dysregularity in sugar regulation in the body as well. And lastly, some medication can cause diabetes, for example, steroids. So I see a lot of over-the-counter steroids prescribed without any proper indication. In the long run, it could be not beneficial for the patients.
Okay, so there is not only elderlies that will have diabetes problem, right?
Yes, you are absolutely right. Even young children, even my youngest diabetes patient is actually 18 years old. All right, so type 2 diabetes doesn't actually limit yourself limit itself to elderly age groups. Yeah.
Okay, so don't think that if you are young, then you won't get diabetes.
Yeah.
Yeah. According to the NHMS 2019 survey, there are 49% of people with diabetes and had never been examined or diagnosed. And delayed diagnosis will lead to some health problems. Doctor, what are the earliest warning signs of diabetes that our audience should be aware of? And is there any case study that you can share?
All right, it's a very good question, Janice. So basically, type 2 diabetes doesn't announce itself. Okay, it comes very gradually. Sometimes we don't even notice. For example, going frequently to the toilet for urination. Okay, the patients might actually wake up at night just to go to the toilet many times, and they think it's just because they actually drank a lot of water, but that's not the truth, right? And they feel very thirsty, very tired. Okay, and they feel hungry all the time, and sometimes it's just a small wound. Okay, you're finding it's getting a bit difficult to heal, not like last time. So this is one of the few symptoms that actually put us risk of developing diabetes, or one of the symptoms that we should recognize. One of the late complication will be actually tingling and numbness. You feel just your hands and foot are numb. That are the other symptoms. But early diagnosis is very important here.
Okay, so if you have the early signs that Dr. Komala have mentioned just now, like frequent urination, excessive thirst, and if you find that your wound is like healing very slowly, then you are suggested go for a medical checkup.
Yes, absolutely.
And doctor, as you said just now, early diagnosis actually is essential for effective diabetes management. So if someone is diagnosed with diabetes, and what are the key steps in managing the diabetes effectively?
All right, so this is what I typically do in my clinics, right? A patient comes with a diagnosis of diabetes. First of all, we will go into what is the lifestyle factor. Okay, lifestyle modification, I would call it. Weight loss, referral to dietitian, and also I would personally look into their diet. What are they eating and what you should eat and should not eat. That's the most important part. Second comes medication, right? Medication, there is oral medication, that's insulin. Okay, depending on how bad is the presentation, meaning how bad is the control. Okay, HbA1c, we have a test like that, and then we have a sugar, fasting sugar or random sugar. From there, I will decide whether this patient needs oral medication or do they need insulin. Right, so that is the basic treatment or management of diabetes.
Okay, so you have mentioned that like people people who is overweight or obese actually can increase the risk of diabetes, and actually weight loss is very important for his or her diabetes control, right?
Yes, so weight loss, Janice, really aids in the control, and probably there's some study backing up reversal of type 2 diabetes mellitus as well. How does obesity contribute to diabetes is by the cytokine enzymes, or we call it adipokines, right? It's from the fat cells, fat globules releasing and causing the cells is resistant to the insulin. So although there is insulin there, the cells are not actually acting as usual to the insulin. So this is what we call insulin resistance. So when we actually reduce weight, the insulin resistance could be reversed, okay, or reduced, and thus the overall diabetes control will be better. So weight loss is, in my opinion, is a very important part, and even is mentioned in our clinical practice guideline as well.
Okay, so we need to lose weight if we have a diabetes problem with it. And then just now you also mentioned that diet also plays a very important role in diabetes control and also losing weight also, right?
Yeah.
Like what kind of diet modification should people with diabetes should follow?
All right, so basically they should understand about balanced diet, all right? There is carbohydrate, there is protein, there is healthy fat. So they should know what is actually a definition of a balanced diet and how many percentages of each classes that they should need. And overall understanding that carbohydrate is the one who will be converted to glucose, right? There's a lot of misconceptions about it, all right? So referral to dietitian is actually very important, but in fact just tracking whatever you're eating is very much important as well.
Yes, diet modification is really important in diabetes control and weight loss control. And I believe that there is some misconception and myth about diabetes in the public. Doctor, is there any misconception or myth that you would like to debunk today? today?
All right, there are actually many, Janice, but I'll just debunk probably one or two today. All right. So the first one is I've been listening to my patients telling that the medication, the diabetes medication, is actually causing kidney disease. All right. So which I would like to clarify, medication that actually used by physicians or endocrinologists to treat diabetes does not cause kidney impairment. In fact, the 80% of the kidney dialysis or end-stage renal failure patients in our country is actually caused by uncontrolled diabetes, but not by the medication. Okay.
Okay, because people might thought that if they take on medicine, they will burden their kidneys, so they will
Yes.
cause like kidney failure. But the truth is not that lah.
Exactly. But they have to remember, if they are at all on presentation, they have kidney function abnormality, there is dose modification, right? The dose won't be the same like everyone, but it not overtly cause kidney failure like what people actually perceive it.
Previously, actually, when we were doing health tests in road shows and in the public, like we noticed that actually some people, they know that they have diabetes, they know that they have high blood sugar, but they didn't really control it very well. Like when we tell them that, okay, you need to modify your diet, you need to cut down sugary drinks, then they will say, no lah, cannot lah, I need to have 1 can of Coke every day.
Right.
Or even if when we tell them that, how about like reducing the sugar in the coffee, or like totally remove the sugar in their coffee, then they will say, no lah, cannot. If I remove the sugar, then the coffee is not nice, cannot fix my craving. So we actually met a lot of people that they know that they have high blood sugar, but they didn't want to modify their diet. And then some they even didn't really follow the diabetes medicine that according to doctor's advice lah.
All right.
Okay, so can you share with us like some of the long-term complication of uncontrolled diabetes, and then how can people prevent them? Yeah.
All right, so complication of diabetes is very important. In fact, when we are screening for diabetes at the first instance, we'll actually screen for complication as well. All right, the most dreaded or the most painful or very dangerous complication that I've seen is actually end-stage renal failure, meaning kidney impairment because of diabetes. Okay, it starts slow with just protein leaking in the urine, but within few years it can just lead to end-stage kidney failure, basically requiring dialysis, and I think you would have heard about it. And also eye complication. In fact, the leading cause of blindness is not exactly congenital or when they were born, it's because of diabetes in Malaysia, right? So eye complication, and then nerve complication, meaning they'll be feeling numbness and tingling numbness over their hand and feet, and they don't know even why, but it's actually because of the uncontrolled diabetes. Okay, these three. And then there's a heart complication, macrovascular we call it. Diabetes patients are increased risk of getting heart attacks, okay, strokes, they are increased risk. So these are the few complications that actually is dreaded and is actually what we need to screen in these individuals.
So actually, if you are diagnosed with diabetes, then you really need to control your blood sugar. You need to keep it under control, otherwise you will have complications like kidney issues, heart issues, nerve damage, and also like eyes problems.
Yes, absolutely right.
Okay, so thank you, doctor, for joining us today to share the knowledge about diabetes. And I believe that our audience have learned a lot in the session today. If you wish to know more about health supplements that can help in blood sugar management, you can stay till the end of this Facebook Live. And last but not least, doctor, in the conjunction with this World Diabetes Month, is there any message or advice that you would like to convey to our audience here on diabetes prevention and diabetes awareness?
All right. Okay, I do have some messages to the audience, which is we need to raise awareness about diabetes mellitus and also prioritize early detection. Let's not wait until there's complication, but during early symptoms that I mentioned, probably we can go for a screening and health screening or medical checkup. All right. Healthy lifestyle choices can actually reduce the burden of diabetes as well. Okay. So with just regular checkups and education, diabetes can be managed effectively, because diabetes shouldn't be the whole book. It should be just a chapter of your life. Okay. Although we are talking about lifestyle modification, but living a fulfilling life is actually essential as well, but also keeping your diabetes on track.
Okay. Okay. So thank you, doctor, for sharing this interesting information and insights with us today. Are you looking for some health supplements that can help you in managing your blood sugar levels? You can look for some herbal ingredients like bitter melon extract. It can help in increasing your insulin production and cellular glucose uptake. You can also look for fenugreek extract. It can help to reduce your insulin resistance and prevents your blood sugar to spike up. There's one more herb called Gymnema sylvestre. It helps to suppress your sugar cravings, prevents you to take extra sugar. Let me introduce you VitaHealth Bitter Melon Complex, which is formulated with 6 hypoglycemic herbs. Besides the 3 ingredients that I had mentioned just now, which is bitter melon, fenugreek, and Gymnema sylvestre extract, it is also added with olive leaf and mistletoe extract, and one more special ingredient called baker yeast extract. This baker's yeast extract is a rich source of beta-glucan, which can help to regulate your blood sugar levels and at the same time lower your total and LDL cholesterol level. Furthermore, VitaHealth have another advanced formula, which is VitaHealth fenugreek extract, a 6-in-1 synergistic herbal blend. Besides bitter melon and Gymnema sylvestre extract, it is formulated with Fenu-Life, a patented concentrated fenugreek extract, which provides 3 times more galactomannan soluble fiber than whole fenugreek seeds. It also features turmeric extract that provides anti-inflammatory effect and antioxidant protection. Besides, it also contains cinnamon bark and banaba leaf extract that helps in regulating your blood sugar levels. This advanced formula is higher strength compared to bitter melon complex. We received good reviews from customers saying that his blood sugar level is under control after taking VitaHealth fenugreek complex regularly for 3 months. So both products, VitaHealth Bitter Melon Complex and VitaHealth Fenugreek Complex, are available at all leading pharmacies, VitaHealth e-store, Last Mall, and Shopee Mall. So here comes the end of this Health on the Beat Facebook Live. Let's keep our blood sugar in check to prevent serious complications of diabetes. Bye bye.